1990, when I graduated from medical school, there was not one single state with an obesity rate over 20%. Now, in 2010, there is not one single state that has an obesity rate under 20%.
So you think that could be turned around, though?
Well,
I mean, you believe it. Do you see it every week? Do you see it every day in your practice?
Absolutely, see it every day.
Where's your practice, by the way, and who's the typical patient that sees you?
Well, my practice is in Lenox, Massachusetts, in Western Mass. We have 3 nutritionists. You can't see the doctor in my practice without seeing the nutritionist, because food, I believe, is medicine. And if you can't use food as medicine, you're not going to solve most
So are you a
problems.
holistic doctor?
I'm not a holistic doctor. I take care of people with a whole list of problems.
Okay, okay.
I look at how everything is connected. I connect the dots. I'm the connect the dots guy. Absolutely. It's a classic. I mean, I've seen people with autoimmune disease, which is also an inflammatory disease, that have been on steroids, that have been on chemo drugs, that have been on $30,000 a year drugs called TNF-alpha blockers that shut off your immune system and cause cancer and overwhelming infection and death. And I've seen people get off all those medications by simply getting rid of the cause of the inflammation. And that's the difference between functional medicine and conventional practice. In conventional medicine, we say, what's the symptom? How do we suppress it? In functional medicine, we say, what's the cause? And how do we get the body back in balance? What's the cause of the inflammation? And how do we deal with that? Not just the downstream symptoms. That's dealing with the smoke, not the fire. Actually get tested. Second step is to get smart about nutrition. You got to know what to eat and how to eat. And it's very simple. Just eat real whole food. If it comes from a factory, don't eat it. If it was grown on a plant, eat it. If it was made in a plant, don't eat it. If it's something your grandmother recognizes food, eat it. I mean, she never heard of Lunchables or Go-Gurts. I mean, your grandmother wouldn't know what that was. Okay. If it's a real food, if it comes from the earth, vegetables, fruit, nuts, seeds, beans, whole grains, these are things that are God made or nature made, and their body knows what to do with them.
Okay, so, and I said this to you respectfully, you're a thin guy, you're lean. What do you know about weight loss?
I know a lot about weight loss.
You've never had to lose weight in your life, though, right?
One, I've treated overweight people and obesity and diabetes for 20 years, and I've focused on this, and I've seen thousands and thousands of patients and tested tens of thousands of patients, so I know a lot about it.
So you can wipe out cravings, by the way?
Cravings, that's easy. In 2 days, people can cut their cravings. They think that they're addicted to food, and they are. But you can stop that addiction. Just like coffee, it takes a couple of days to get out of your system, but you can cut cravings by some very simple steps. One, you got to balance your blood sugar, so you got to eat small, frequent meals, 3 or 4 hours every meal, and you got to have snacks. You got to have protein with every meal. You got to eat breakfast, so you got to eat early and eat often. Second, you have to deal with things that are driving this, like sugar, flour, processed foods. You got to go cold turkey. No flour, no sugar, and no liquid calories. Very powerful. If you just shut that off, within a few days, you'll see cutting cravings. Okay,
diabetes. We have to go back on the topic here, diabetes. So what are the myths about diabetes, maybe that frustrate you or drive you nuts, that you hear?
The first myth is that it's genetic. So let me ask you this. We have changed our population from relatively thin population to a massively obese population and seen diabetes increase 7 to 8-fold just in the last 20 years. If it was genetic, how did our genes change? They only change 0.2% every 20,000 years. Our environments change, our diets change, our stress levels change, our activity levels changed. Those things change, not our genes. So we can change our genes by changing the environment. We change our gene expression. That happens, but our genes don't really change. Second is that diabetes can be fixed by medication and surgery. Well, guess what? There's some new studies that show that diabetes medication has been responsible for 47,000 excess cardiac deaths since it was introduced in 1999. That's Avandia. That's crazy. We know that gastric bypass may work for diabetes, but it's not the real solution.
Okay, but people taking insulin, people that are watching this, whether it's on YouTube or on television or wherever, if they're taking insulin, type 2 diabetics, okay, and their doctor said, but you have to take this insulin, what is your response to that?
My response is, you should do what our national policies and government recommendations and all the health organizations recommend, which is change your diet and change your activity level first and then see what happens. The problem is most people just make incremental changes. And if Benjamin Franklin said an ounce of prevention is worth a pound of cure. Most people with diabetes need a pound of cure.